Well, with the country officially in the fourth wave, there's an urgent need to get people vaccinated. But many remain reluctant to do so. What can be done to change their minds, to change their outlook on this thing? Well, for more on this, I'm joined by Professor Mark Tomlinson. He's with Stellenbosch University's Institute for Life Course Health Research in the Department of Global Health. Professor Tomlinson, thank you so much for your time. Now, I remember speaking to you last year. It does seem like a lifetime ago, our first year of this pandemic. And our conversation stuck with me because you were one of the first people in your expertise as in behavioral sciences that pointed out that South Africans have a very particular way that they prefer to be communicated with. And this is what you said government and the health department needed to keep in mind when approaching talking about vaccinations. And at the time, we weren't even talking about vaccinations. We were talking about COVID-19 just in general and how people should be changing their behavior to try and prevent catching this monster that we're still learning about at the time. And ever since then, that conversation has stuck with me because what you've said has really just transpired and proved itself over and over again. What have you learned since we last spoke about how South Africans need to be communicated with if we need them to do what's best for themselves, for their own health, and for that of their community?
Thanks so much, and great to be here. I mean, I think, as you say, we've learned a lot, and at the same time, we're still making some of the same mistakes, probably. I mean, one of the important things, just as a clarification right up front to say, is that what happens when we have these numbers of vaccine uptake, for example, either dropping or staying stagnant, we immediately assume that, or some people assume it's because of vaccine refusal or the anti-vaxxers, or, you know, and in fact, for very many people, it's not that people don't want to. It's if you think about a continuum, it's sort of some that have their doubts and can quite easily their mind can be changed. There's of course those who, no matter what happens, aren't going to have their minds changed. But then there are actually a lot of people in South Africa who are very, very, willing to to be vaccinated, but can't get access to it. Affording the 20 Rand with a taxi to get the vaccination is actually, given all their other struggles in the world, is actually too much. And so I think that's a very important thing to just to say. It's not about rampant anti-vaccinations. I don't believe. It's about access, and when you've got so many struggles, then that becomes a very difficult thing to do. I also think that we have, and there are a lot of reasons for it, as we've seen in the last year, is when people within the health department themselves are then suspended because of alleged fraud, for example. The very basis of why so many people listen to authority, trust, is broken. And I think we still struggle massively with this idea of trust. That if you trust somebody, if you trust the scientists, if you trust the politicians, if you trust the health department, people, I believe, in South Africa will do what is necessary. South Africans aren't a group of people who are, rampantly cruel to older people or to other people. We actually have this bedrock of care, I think. But there's so many other factors, and if we don't get the trust right, if we don't get the access right, then it's incredibly difficult to get those numbers up.
Now, because of that deficit of trust, and it's not just now, I think, if you think about the Zondo Commission and all of that's transpired, we do have a deficit of trust when it comes to government. And if you focus down into the health department, the digital vibe saga, which of course was money that was supposed to be meant to be spent on getting information out there. It was such important work that needed to be done. That doesn't help the situation either. Do you then think that because of that issue, that there needs to be more of a focus on community-level communication with people, communities being communicated with by health workers that they know, community leaders that they know, so that there is that relationship, that there is a relationship of trust, and that they are more open to getting information and getting help from those people. Do you think that message is finally coming through? We just had statistics earlier today saying that just in the last week or so, we've seen more community-based work going out. Local governments have been getting out into various far-flung communities, and we've seen an uptick in vaccinations. Is this the way to go? Community-based communication and information from people that is familiar with people living in those areas?
I think you're spot on. I mean, I think that's the crux of it. And I was, when I, seeing the insert before, with the priest talking, I think it's about people believe, trust and believe religious leaders. And so when they're saying vaccinate and they're out there and they're saying it repeatedly, that's important. Somebody last year, I may have mentioned that at last interview, last year, someone in the Western Cape used this term, professors of the street. Instead of letting of always going to the scientists or to the academics who in many ways, often to the average person on the street are people sitting in an ivory tower to some extent. It's the people who know the communities, who've seen what happens in these terrible waves that we've had. So community leaders, professors of the street, religious leaders. I'm not sure we've fully utilized our army of community health workers who are there at the front lines, in people's homes, in the clinics, and it's all of those things. And the people you trust, that link to what you see. So, I mean, I think I've said this before, when people are told to go vaccinate at the Cape Town Convention Centre, and they may have passed that in a taxi on the way to work and they live, 30 kilometers away. What does that mean to them? But when they see a pop-up round the corner and they see their neighbors standing in the queue, the impact of that, not just about having the pop-up so there's access, but they're seeing people like them, people they know, who then, if they have doubts and the person they're seeing gets vaccinated and actually is fine 2 weeks later and a month later and hasn't, grown horns or been abducted by some alien because of the vaccine or whatever the anti-vaxxers are saying, that has a huge, huge impact. So exactly, people that people trust at community level and seeing people they know, they like, they trust, they can follow them being vaccinated and having access to it are utterly key.
I take your point earlier about how we probably have put too much focus on the anti-vaxxers, and that's because they might be a smaller number, but they are a louder number because of social media. But at the same time, you speak about your professors and scientists of the street. We have a grouping, or we have numbers of people who are far more keen to believe professors of YouTube or professors of a video that some auntie has sent them on Facebook or on WhatsApp. And perhaps because you're a behavioral scientist, you can answer a question that so many of us have been asking all the time. What is it that makes somebody believe something that is said to them by a talk show host on some American, Canadian or New Zealand network that's been sent to them on YouTube than they do believe a top virologist from Wits University or Stellenbosch University or from the WHO? What is it about the human psyche that makes them believe that over something far more relatable and closer to home?
There are probably a million answers to that. Again, that is a fantastic question. I think part of the answer is that is taking a step back and trying to understand how Facebook, how the algorithm, Twitter, how these algorithms work. And what people don't know is that behind the scenes, this algorithm is tracking you. There's a piece of data that I read this week that the average child in the United States, by the time they are 13 years old or 12 years old, Facebook and Google have 13,000 data points on the child, a 13-year-old child, based on where they've been, their mobile phone access. So they're tracking us, they know what we're doing, they know what we're watching, and they know what we're buying, and everything. And so if you imagine in your network of Facebook friends, and there's one person that's now starting to look at some of these very well-produced, very professional-looking, seemingly great research, underlying these stories, and then your friend gets it, and then because you're part of the network, you're immediately now in that algorithm. You start watching them. What people don't know is behind the scenes, the algorithm is feeding you more of the same. And so you're having an initial, maybe for some people, a skeptical idea. Skepticism is good. Don't just believe everything you see and are told. So a bit of skepticism is good. But then you're up against this behemoth, this machine of Facebook and Google, and these algorithms that are feeding you certain things and pushing you down a certain path. And before you know it, there was a fantastic podcast a couple of years ago called The Rabbit Hole. I think the New York Times did it, about how people go down these rabbit holes on YouTube and on Facebook. And I don't think it's people, again, if I'm saying to you, and your question is, people trust people that are close to them at community level. Facebook's a kind of community, so people, I suppose, instinctively want to trust their friends. They want to trust people they know, and normally that's probably okay, because you're not up against this algorithm. You don't have this thing that's churning in the background, pushing certain things at you. And so I think it takes what they've done so utterly brilliantly, I mean, very dangerously as well, I suspect, but utterly brilliantly, these social media companies, is they've taken a perfectly normal human, not even a frailty, just, we love friends, we want to be connected, and they've taken that and they've weaponized that against people, and that I think we need to really, really push back against.
One final question before I let you go, although I'm sure this is a conversation that could go on for quite some time. What about the element of fear? Like I said to you earlier, we just got statistics saying that since the announcement of the identification of the Omicron variant, we've seen a spike in people taking up the vaccination from 36% to 43%. I hope I'm quoting that number specifically. What about the element of fear, the fear factor in getting people to get vaccinated? I know it could be quite a flippant question to ask, because should we be using fear to try and get people vaccinated for their own good? How do people react to fear versus a more positive and perhaps a longer process of trying to get them the right information so that they can eventually make the right decision?
I don't think we can try and I suppose I'm contradicting myself now. I'm certainly not, and I don't think behavioral scientists are good enough to do anything like that, to try and force people to do something like out of fear or whatever. I think we have to give people information. We have to trust, to some extent, people's will to do the right thing, and I think most people do. And so we see this spike, and I'm sure for some of those it's fear-driven. For some it might have been not so much fear-driven, but actually it's just a reminder that you go, when we have these waves, then the wave goes down, and then everyone gets into the sense of complacency. And, I'll get vaccinated next week, or now the 12 to 18-year-olds can get vaccinated. I'll take my child next week. And so you get into the sense of complacency. Omicron comes along and people go, oh no, and off they go. So there's a bit of fear, but it's more just a little bit of a trigger for a reminder. But I think for many people, fear doesn't work, because fear can very easily be countered. One of the classic cases is often the first attempts to stop people smoking, for example, was to show people the most absurdly disgusting pictures of diseased lungs. Yeah. And for a small group of people that works, but for most people they go, no, that's too extreme, that's not going to happen to me. I'm a healthy 35-year-old, I don't have any underlying conditions, I'll be okay. So the fear doesn't work for most people. So for some, maybe, but I don't think people respond very well to people trying to scare them. There's enough happening in the reality of the world to scare us. We probably don't need to add to that.
Absolutely. I'm going to squeeze one more question to you now. And this is one perhaps not to do with what we're currently going through, but perhaps a world that we can imagine post-coronavirus, if that would ever be the case. I was saying to somebody, I don't know if I could ever go back to being in an environment with lots of crowds, be it a stadium or a big music concert. I just feel like I wouldn't be comfortable. From a behavioral science point of view, are you already looking at how, as a people, the human sort of psyche now changes when they look at crowds, when they look at being among strangers on public transport and places where before we wouldn't have thought twice, but now we do because of this experience of this pandemic over the last 2 years?
And I suspect that one of the things we've learned from previous pandemics is that pandemics change the world. They change societies. There's no way of denying that. But what we have learned is they often change societies in ways that you couldn't imagine. So in the 1920s, after the terrible Spanish flu of 1918, 1919, what actually happened, there was the exact opposite of what you've just said. People went in the roaring 20s. People partied like they've never partied before. And so some people are predicting that it could be the exact opposite of that. Sure, some people will never look at a crowd again. I suspect I'm with you in that. But the reality is maybe young people go, like, life's so, like, who knows what's going to happen? Let's just go party up a storm. So society will change, no doubt, but maybe not quite how we imagine it.
Gosh, your lectures are going to be so interesting over the next few years based on that alone. Thank you so much for your time, as always. That's Stellenbosch University's Professor Mark Tomlinson. He's with the Institute for Life Course Health Research with the Department of Global Health. Fascinating insights there. We thank him for his time this evening.